Miss Tracy. How are you? How are you feeling today?
I'm feeling okay.
Me and I'm Shelby, and I'm going to be your nurse today. And this is my student nurse, Miss Katie.
Hi Katie.
She's here from Faulkner State. Is it okay if she assists me today and to help taking care of you? Okay. Well, I just need to check your armband and see if you have any allergies. Okay. Can you tell me your name and date of birth?
Tracy May, July 18th, 1990.
Okay.
You're so young.
Do you have any allergies?
I do not.
Okay. I have some news. Since your recent brain surgery, we need to insert a Foley catheter to monitor you for what we call diabetes insipidus. The doctor does want us to put in a Foley so we can keep strict I&O. Will that be okay?
Does it kind of hurt?
You might feel some discomfort at first, but after it's inserted, then no, ma'am. Okay. Excited? All right. So we're gonna go ahead and get everything set up. Okay. So you just try and stay calm. All right. If you'll go ahead and put your legs apart for me, just a little, and we'll keep you covered for your privacy. All right. We're gonna put this down so we don't get your bed sheets all messed up. All right, Katie, do you want to do some perineal care? Have you done that before?
No, Nurse Shelby, I've not done that before.
Okay, it's all right. I'll talk you through it.
Okay.
We can do this, okay?
Okay,
All right, are you right-handed or
I'm
left-handed?
right-handed.
Okay, so do you want to get on that side?
Yes.
All right. Don't feel bad. One for the left side labia and then one for the right side of the labia. And then one straight down.
What a good nursing student you are.
All right, Katie. So you want to go ahead and open that. Have you put sterile gloves on before?
No,
No?
this is my first semester.
First semester?
Yeah.
Okay. All right. So do you want to watch me do it?
Yes.
Okay. We verified that we have an order from the doctor, and we've gathered all of our equipment, and we're going to make sure that the packaging is all, and the integrity of the packaging is fine. Everything is in date, and what we're going to do is we're going to set up our sterile field here, because obviously that's where we're going to insert our Foley.
Ms. May, do you have any allergies?
I do not.
Like to shellfish or betadine? Okay,
Okay. So.
she doesn't have any allergies.
Sometimes people with shellfish allergies can react to the betadine. So if they are allergic to shellfish, then we won't use the betadine, we'll use chlorhexidine.
Okay.
When you're opening up a kit, you always open up away from you.
Mm-hmm.
You touch only the shiny side, so you can only touch everything out.
Okay, should I help you?
No,
No,
definitely
okay.
not. Don't cross the sterile field, because
Okay,
then
sorry.
everything in here would be contaminated.
Okay,
So
that's bad.
it would be very bad, yes. So at this point, I'm gonna take off these gloves,
Okay.
because I need to put on sterile gloves. So
Okay,
they're on the top, so that's the first thing that you touch.
okay. Why do you need to be sterile for this procedure?
Because we don't want to introduce any bacteria into her bladder so that she would have a UTI, because that is one of the #1 hospital-acquired infections. So
That makes sense.
you always put goggles on when there is a risk of being splashed by anything. So
Oh, splash.
even though we are putting in a Foley, and there's a very low chance of that actually going anywhere, you can never be too cautious. I'm going to get you to lift this bed sheet up just a little so I can place, we're still maintaining privacy, but this is going to be a drape. So what we're going to do is you're going to open it, and I'm still sterile. Everything with my beds are sterile. So what I'm going to do is I'm going to take this, I'm just going to drop it, right? We don't need that one, so we just throw it away. And this is our lube. So what we're going to do, you're just going to put it in one of these containers. Because when I was in fundamentals, a very smart teacher told me that you play with everything in your toy box. You touch everything in your toy box before you play with it, right?
Mm-hmm.
So this is our toy box. So what we're going to do is we're going to touch everything in here before you play with it, right?
Mm-hmm.
So this is our toy box. So what we're going to do is we're going to touch everything in here and make sure that it's all working, that it all functions properly before we actually touch the patient. So we're opening up our swabs.
How many do you usually use?
We usually use 3.
Okay.
One for the right side of the labia, the one for the left side labia and then one straight down the middle. And what we'll do is I'll show you the betadine link. And what happens is when you cross over the urethra, it'll kind of open up just for a second, and that shows you where you need to insert your catheter. So this is our sterile water to check balloon. So be careful with this because it will whip around and then this would not be sterile anymore. So leave this on here as well. So we do this, attach it. Check that your balloon inflates without busting equally on both sides. So what that'll do, that'll sit up against the opening, this will sit in the bladder on the opening of the urethra so it holds the catheter in place so it doesn't sit back out. So we'll deflate that and we'll leave it curled up in here. This is all attached and we'll just leave it here. This is for us to collect our sterile specimen, but I'm just going to leave that in the box because we don't need it right now. So everything is touched and played with. So I'm going to leave this right here. Okay. All right, it's me a little cold. All right, you gonna watch the wink?
Oh, the wink. I saw it.
Good. All right, Miss May, as I insert this, I'm going to need you to bear down like you're having a bowel movement, okay? That's going to help and facilitate this in, okay? Okay. All right.
1, 2, 3.
All right, so we're going to watch for urine. All right, so you see
I
the
see
urine?
some pee.
All right, awesome. So we're going to advance for 2 to 3 more centimeters, and then we're going to inflate our balloon.
Oh.
All right. And then we're going to give it a little tug, make sure it stays in there, and disconnect. Now none of this has to be sterile anymore because now we've inserted. So you can let go. We'll cover her back up. And we're going to,
It's over?
Place the stat
it
lock.
is over, Miss Tracy May. So we're going to place the
have
stat
one.
lock
Okay.
on the side of your leg. And then what we'll go ahead and do is, because it's the first urine that's in here, this whole container is still sterile, so we can actually
Collect the specimen.
collect the sterile specimen. And be careful when you are, let's take all this up. Be careful when you are hanging your Foley bag that you don't want any dependent loops, because then that would have urine stasis, and then that can actually back up into the patient. So what we're going to do is we're going to hang it where it lays flat all the way down.
Can we use this little clippy thing?
Yes, ma'am. That's what we use to clip it to the bed. So, and then we can get over here. We have that. And then I'll get this first urine. All right. I'll clip that and put that back. And then we're going to label this with her patient labels at bedside, put it in a biohazard bag, and
Okay.
send it down to lab.
Labeled.
Your student initials, time and date. All right, and we're going to put it in a biohazard bag, and we're going to send it down to lab.
Okay.
All right, Miss May, do you need anything else? Are you comfortable?
I am.
All right, well, let us know, and here's your call bell. And this bed is in the lowest position, and we got 3 side rails up. All right, make sure you call us if you need anything.
Will do.
Bye.
Okay, so the Foley bundle includes StatLock, PeriCare, Foley Care, and no dependent loops.
All right, so we're gonna do this because we don't want any stasis of urine in the actual system with the Foley. So with the no dependent loop, so you don't want any kinks for the urine to travel back, and it promotes the growth of bacteria. And you put the stat lock onto the leg, so you don't have a risk of pulling it out or them uncatheterizing themselves. And you're gonna do the Foley Care at least twice a shift, just to break down on the growth of bacteria. You do they have these wipes that are specifically for Foley catheters that you use. 2 wipes, and you go around the perineum, and then you take one, you go down the actual catheter itself and around the bag, and you clean the bag with a cavi wipe. And That's it.
That smells good.
Liz is gonna edit this part out.
This is not a sterile wedding video. It's fine. Just put on gloves.
Oh, they're so sticky.
Are you sterile?
Or actually,
Yes.
I'll use that part too.
Yeah.
You could have put those on yourself.
Nope, she's still recording.
That in the mannequin.
He's touching me.
Oh, so
Sorry.
you're on the catheter now. Just
gonna
go
do
ahead
it
to
again.
the catheter,
not
securing
weird
the
at all.
catheter. So now that the catheter's in place, we put a stat lock.
So do you want me just to skip cleaning and
Yes.
insert it?
Yeah.
Okay.
Not
So do you want us to?